I'm Kathy Angela, Vice President of Education at the Immune Deficiency Foundation, and I will be your host this evening. First, a quick disclaimer that, as always, this event is not medical advice, and it is not intended to be a substitute for medical advice, diagnosis, or treatment. Please always seek the advice of a physician or other qualified health provider with questions concerning a medical condition. Programs, I guess, tonight that you might be interested in because they also involve support would be our peer support program, where you can get one-to-one support from somebody else in the PI community who is a peer support coach, and they will either be living with a PI or have a family member with a PI, and that support can be provided one-to-one via email, via phone, and I suppose nowadays even via Zoom. And the other program that we have is Get Connected groups, and there will be a slide coming up where you will see that our Get Connected groups are nationwide and ongoing throughout the year. So on behalf of the Immune Deficiency Foundation tonight, welcome. The formal welcome, whether this is your first time attending or whether you've joined us before, we are so glad you are here. And we hope that you find tonight as beneficial as possible. Now, as you can see from our mission, IDF is dedicated to fostering a community empowered by advocacy, education, and research. For over 40 years, IDF has been committed to the PI community, serving as a trusted resource and working to ensure that everyone has the tools and resources they need to live better lives. It is by offering these tools and resources that IDF can fulfill its mission of seeking to ensure that everyone in the PI community is fully informed and understanding of the PI diagnosis that affects them, all available treatment options, the expected standard of care, and all of their opportunities for connection and support within the PI community. And speaking of support, IDF, just like I said, has Get Connected groups, which are offered virtually via Zoom on an ongoing basis throughout the nation, throughout the year. And to take a look at where those events are, when those events are coming up, go to our calendar of events and easy to register. Other events coming up next week, Thursday evening, there is a COVID-19 Where Are We Now forum. And then the next night on March 5th, there is a teen forum, and it's all about college night, heading off to college. I know we've had parents say, can you have something for kids going to college? Yes, we do. We've been listening. And then on March 10th, there will be a SCID Compass forum about gene therapy for SCID. IDF forums are made possible by our wonderful sponsors. It is due to their partnerships and contributions that IDF is able to provide programs such as this one and other services to everyone in the PI community. And I would like you to join me in thanking our 2020 sponsors who will be rejoining us again soon. And we have some who have already rejoined us. So this year, we have CSL Behring and Grifols who have rejoined us as core service leaders, and looking forward to having Takeda join us soon. Octapharma will be joining us as a core services supporter. Horizon Therapeutics has joined us this year as a core service sustainer. Core service contributors, Leadium Biosciences and ADMA Biologics will be joining us soon. Our sustaining national sustainer, Accredo, has already joined us, and national patrons this year, we look forward to having back with us Diplomat Specialty Infusion, Kedrion Biopharma, CVS Specialty Quorum, CVS Specialty Infusion Services, Carew Medical Systems, Caba Fusion, and Celio Health has already joined us. So, thank you. We cannot do this without you, and thank you so much for last year, and thank you for this year. Now I would like to introduce my colleague, Angela, who is going to invite you to a special event. Angela, take it away.
Thank you so much, Kathy. So hi, everyone. So my name's Angela, and I'm super excited to share that we are having our very first Zebra Paint Night. So it's our own do-it-yourself fundraiser. We're showing you all how super easy it is to do, and we would be honored if you would join us. So how do you sign up, you might ask? So you just go to primaryimmune.org/events, and you can find out all the information. It's Wednesday, April 7th. It's virtual via Zoom, and we send you all of the supplies. So you don't have to worry about a thing. And then not only do you get to paint this beautiful picture of a zebra, but you get to take the time to also, you can connect with the community, and you can learn how you yourself can do a super easy do-it-yourself fundraiser. So I really hope you join us on Wednesday, April 7th, and I look forward to seeing you all then. Kathy?
Thank you, Angela. It sounds really fun. And I hope everybody will take a look and try to join us. So at this time, I would like to invite Sid Fadke from Acredo for a word from our sponsor. Sid, take it away.
Hey, thank you, Kathy. Good to be here. Good evening, everyone. I am Sid Fadke. I'm the product line director for our immune disorders TRC here at Acredo. Acredo is a best-in-class specialty pharmacy, and we have a nationwide network of nurses that do your home IG infusions, and we also have specialty IG pharmacists within our ID TRC or immune disorders TRC. It's really an honor and a privilege to be part of this ID community, and this is coming up on our second year of doing these virtual events, and it's been tremendous. So thanks to the IDF for pivoting so quickly last year and then just continuing to run them so successfully. So much appreciated. We found them to be very informative and successful. So thanks again for that. And looking forward to today's presenter. Very crucial topic here, managing stress. So I'm really looking forward to what our presenter has to say about that. Today, representing me here for Acredo is Tommy Dukes, and we will see you all in the breakouts after the presentation. So thanks, everyone, and thanks, Kathy.
Thank you, Sid. Now I would like to invite Melissa Goldman from CSL Behring from a word from our sponsor.
Thank you so much. I just wanted to say thank you to the IDF. And it's been really great to participate in these events in the past, and we're looking forward to doing so moving forward. At CSL Behring, we're the makers of both Hizentra, which is our 20% subcutaneous IG therapy, and also Privigen, which is our 10% IVIG product. And we have also shown our ongoing commitment to innovation as evidenced by our recent launch of Hizentra's prefilled syringes, which are now available in a 5, 10, and a 20 milliliter syringe. So thank you again so much for having us, and we really, really look forward to partnering together in 2021.
Thank you, Melissa. And now I would like to invite Jim Jones from Grifols for a word from our sponsor.
Good evening, everyone. It's been a little bit, but I'm pleased to be back. My name is Jim Jones. I'm with Grifols. I'm a patient advocacy coordinator with Grifols, and I am joined by our one of our talented nurse educators, Laura Smith, tonight. Grifols is the manufacturer of Gamunex C, very likely a name many of you are familiar with, and a new 20% sub-Q called Zembify. And I look forward to sharing some of the resources we have, trying to stay on topic of managing stress and how we can help patients do just that. So thanks for having us today.
Thank you, Jim. We look forward to seeing all of our sponsors tonight during the virtual exhibit hall. So we hope that you will, everybody, stay with us and visit with all of our sponsors. So at this time, I would officially like to welcome our presenter, Jodi Taub. Jodi is a psychotherapist with a private practice in New York City. She has over 23 years of direct care experience with children, adolescents, and adults. She practices individual, couples, family, and group therapies, and her specialty area is chronic illness. Jodi is also an expert lecturer, published writer, and active mental health contributor for the Immune Deficiency Foundation. So at this time, please join me in welcoming Jodi.
Thanks, Kathy, for having me here today. I'm really looking forward to this presentation. This is my first time in this new format, virtual format, and I'm really thrilled to have access to so many people who may not have had opportunities to participate in IDF in-person meetings. The virtual forum, particularly during the pandemic, is so important, but I hope it continues to be an ongoing forum. So, about me, who am I? So I am, first and foremost, I'm a patient. So not only am I a mental health provider, but I'm a part of this wonderful community. And I feel very honored to have this unique experience where I can bring in my experience as a psychotherapist and mental health care provider. And at the same point, also my experience as a patient, because I'm going through this at the same time as you are. We're all going through this global pandemic together. And I'm here because I live this, I get it, I understand it, and we all do better when we do this together. So thank you for having me here today. So today we're going to talk about balancing mental and physical health, managing stress and isolation, and then in the end, I'm going to provide some mental health resources that you can kind of pick and choose and see what might be helpful for you. 1 year later, my goodness, can you believe we're approaching a year since the pandemic first began? And I know for many of us, it's felt like 5 years, but we've made it and we've gotten through and we're at a new kind of juncture in this, and we're moving forward, and there's a lot of hope and a lot of really great things going on in terms of the availability of vaccines and our hope to get to herd immunity and more medications and treatments that can treat COVID. But we're still in it, and we're just coming off, if you're in the Northeast or the Midwest, we're coming off a difficult winter, and a lot of people have COVID fatigue. And I want to talk a little bit about where we're going from here and how to continue to cope with the ongoing pandemic. So it's fair to anticipate that there's still going to be ongoing transitions and shifting expectations. And there's going to be times that we can do more or less than others. And what will remain consistent is our ability to manage our emotions and our choices. So no matter what's going on around us, that we can stay grounded in how we handle things, and figure out where you are. Take some time right now. I think that this is a good inflection point that we're hitting the year end. And when we hit anniversary markers, it's good to kind of reflect on things and see what's worked for you over the past year and some things that we might need to shift as we continue to live through the pandemic. So balancing physical and mental health. I want to be clear before I start this, this part of the outline today, that this is not meant to blame, it's meant to explain. I am a PI patient as well, and I know the road and the journey to getting diagnosed is difficult, and I know how hard it is to explain to other people the severity and all that we go through of living with chronic and invisible conditions. So you are not to blame because you have you have an immune system that doesn't function in the way that we want it to. But what I'm going to try to do today is show you that sort of that point where we can improve our physical and mental health and where they sort of align, and why it's important for our mental health to be in check so that we can better manage our physical health. So when we are better able to manage our mental health, it makes it easier to manage all the tasks required for our physical health. managing medication and scheduling appointments and dealing with insurance companies and infusion times and time spending, resting and not feeling well is akin to a full-time job. So all of you who are on this call today or live or care for somebody who has a primary immunodeficiency, it takes a whole team to get this whole thing going. So in order to be able to be present and manage it, it makes it a lot easier when we're in a better emotional space. So the benefits of improved mental health are our ability to problem solve, and that problem solving capability allows us to better tackle our physical health demands. It increases our ability to maintain close relationships and support, which decreases isolation and loneliness and improves health outcomes. It's easier to manage transitions with flexibility and the roller coaster of living with chronic healthcare conditions when we are experiencing improved mental health. Isolation and loneliness. I know this has been a big topic for everybody who's experiencing the pandemic. Loneliness is not just about the absence of others, but about the perception of feeling alone. So you could be spending time with family and friends, and those things are most often obvious, but often we don't recognize the importance of less significant but meaningful relationships. So you could be missing a coworker or a sibling or an acquaintance from your child's recreational activities or a workout class you used to attend. I can't tell you how many people have really recognized the importance of just the everyday people that we come in contact with, and how important those people were to our lives too, and we're missing them. So you can feel isolation in the presence of others. So isolation doesn't mean you're just by yourself and you're physically alone. You can feel isolated when you're feeling alone within yourself or you're experiencing something that's difficult. And it's easy to compare ourselves to others, especially when we're not seeing people in person. And social media may be our only social window. Why do I feel lonely when I'm around my family all the time? I shouldn't feel lonely because I can't tell you how many times a day I'm a psychotherapist. I have a private practice where everybody's telling me the same exact thing. So we're all going through this at the same time. So everybody will say to me, the last 2 months, people have been having a really hard time, and every person is talking about how lonely they feel, but they think that everyone else is doing okay. And that's because it's easy to make assumptions about other people. So then we sort of shame ourselves thinking, oh, we shouldn't feel this way and no one else is feeling this way. But the truth is we all are. The entire planet is grieving right now, and they're likely feeling the same way you do too. So when we feel lonely or isolated, it can set off a negative thought cycle. So we assume that we're the only ones feeling the way that we do, and we don't want to burden other people. So you could look at somebody on Facebook and say, oh, well, their job's going great, or they're having a great time with their family, and I'm living by myself. It's really easy to compare ourselves to other people, but everybody is having some sort of loss. So there are people who've lost their jobs. There's people who are having trouble in relationships. There's lots of different stuff going on. There's people who have healthcare conditions. So when you open up that opportunity to tell someone else that you're having a hard time, you're not just helping yourself and venting and saying, okay, I'm having a hard time, I want you to just listen to me. But you're opening that up to someone else to talk to you and say, hey, I'm feeling that way too. And that's okay. And this is normal for us to feel this way. Pandemic trauma for immunocompromised individuals and their loved ones. Living with a chronic illness on the road to primary immunodeficiency is traumatic. Witnessing your child's human suffering is traumatic. Living with or loving somebody with a compromised immune system during a global pandemic is traumatic. And I put the zebra picture in, and the reason I'm wearing my sweater today is for support for all of us. Everybody in the world is having a hard time, but in particular for those of us in this community, being threatened by a serious virus and it is different, and it comes with a different set of circumstances that other people might not have to worry about. We have to worry about access to care, worrying about the people who care for us, our nurses, our infusion nurses, our physicians. Are they going to make us sick? And then the people around us, you know, they may have to take extra precautions for us and realize that if we do get sick or if we don't have access to care, that could be harder for us. And I want to talk a little bit about trauma for individuals who live with compromised immune systems and individuals who live with chronic healthcare conditions. When we typically think of trauma, we think of an outside event, something traumatic happened to us. We were in a war, or there was something that occurred, and that particular trauma influenced the way that we responded. But chronic illness also is a trauma, and chronic illness is complex trauma. So complex trauma involves chronic and multiple traumas during developmentally vulnerable times. Complex trauma also refers to situations such as acute chronic illness that require intensive medical interventions and are painful. Complex trauma is repetitive, it's cumulative over time, and it's specific relationships and contexts, hence chronic illness. And complex trauma involves significant difficulties with emotional, behavioral, somatic, and cognitive dysregulation. So there's a difference between having PTSD and having complex trauma because it's ongoing. And it's important that you recognize that. Many people this year probably have had traumatic responses. Oh my gosh, here's COVID, and how am I going to get my care? And what happens if I get sick and I get exposed at the hospital? Many of you have probably experienced post-traumatic stress symptoms and didn't realize it. You know, when you have a flare-up, when you feel like you're going to get sick again, if you're in the hospital, and all of a sudden it brings back those traumatic memories. And it's not because you don't know how to cope. It's because our exposure and living with chronic healthcare conditions exposes you to trauma. So we're naturally going to have a trauma response. And the other difference in trauma with individuals with chronic healthcare conditions is that the trauma comes from within. It's not always an outside threat. Now, COVID's definitely an outside threat. So this year we do have that outside threat, but the trauma with living with a chronic illness is that it's your body. So it's an internal trigger and not trusting your own body to respond to things. And that's a different set of circumstances than other types of trauma. And I think it's important for our community to recognize that. The research over the last 5 years has improved dramatically and may help you to understand why you're feeling the way that you're feeling instead of shaming yourself or feeling badly about it. And then the secondary part of that is it may help you to recognize the importance of really working on your mental health and getting help when you need it. So research and risk factors associated with pandemic loneliness and isolation. So I included two particular research articles because one is a more recent article that talks about primary immunodeficiency and for those of us that were at a higher risk of developing mental illness. And the other one is a longitudinal study that studied loneliness and social distancing during the pandemic. So loneliness can mimic neurological responses to pain. Elevated loneliness is associated with more depressive and anxious symptoms. Well, that makes sense. Loneliness doesn't cause happiness. Loneliness will cause more depressive and anxious symptoms. But on a positive note, it also in the study showed that opportunities for time in nature and creative activities at home can improve the stress outcomes. So it's not like, okay, well, I'm lonely because I'm living in the pandemic and woe is me, there's nothing I can do. We know that research is showing that if we do some creative activities at home and we get out for walks, that actually we're seeing improvement in mental health outcomes. So at the end of this, I will talk a little bit more about some of those creative activities that you can do, but this is showing you why. And so it's not just me saying, hey, go for a walk, you're going to feel great. It's that, you know, if you do this over time, it can help improve your outcomes. The second part that I wanted to talk about is this recent study in terms of increased psychiatric symptoms for mental illness and suicidal behavior. And that the purpose of me reminding you of this is it's not meant to blame. Again, it's meant to explain. And so there are physiological reasons as a result of our chronic persistent infections and viruses, which may have caused inflammation within the brain, which can lead to neurological changes, which can predispose an individual to psychiatric and mental health conditions and symptoms. So we're seeing this with COVID. So 11% of COVID patients per recent research studies are presenting with psychiatric illness. And the reason why is that there's inflammation. They believe that it's inflammation within the brain that's causing these symptoms. So because inherent to having a primary immunodeficiency is being exposed to severe chronic and persistent infections and viruses, there may be a physiological reason that you may have presented with some of these clinical issues. And we can't control our body's response to a bacterial or viral pathogen. So our body may take that pathogen or bacteria, it's going to do what it wants. But if we do become sick and we rest and we take our medications and we care for ourselves, we may be able to better manage the course of the illness. And this is the same way I want you to look at mental health. We may have a predisposition to certain psychiatric symptoms. However, if we utilize our mental health coping techniques in the same way that we approach physical health, we can decrease the severity of our mental health symptoms. Neuroplasticity. So this is a big word and a complex topic. So I'm giving you a neuroplasticity light and a brief introduction to what it is to explain a little bit more how our brain and is connected to our emotions and how our physical symptoms also are related to our mental health as well. So neuroplasticity is a newer science, and basically what it studies is how our brain can be reshaped by experiences and thoughts, both negative or positive, just like exercising can reshape muscles. So in the same way that we know that if you exercise one time within 3 months, that's probably not going to do very much, but if you consistently spend time doing it consistently every week, you can start to see a change. And that's the same thing that we can do for our brain. So stress, shame, and trauma can activate 2 brain networks. The default network, which focuses on negative thoughts leading to feelings of shame, isolation, and depression, or the task mode network. By activating the task mode network, we reduce negative thoughts. Shame, isolation, loneliness, and trauma activates the default network and the pain system part of the brain. So when the brain is triggered, it sends the body into shutdown, creating negative thinking and difficulty with problem solving. So our goal is that we want to activate the task mode network through task-oriented behaviors. So I'm going to talk about some tasks today, but what this means is that instead of being in a situation where when you get triggered and you're overwhelmed and you're feeling badly, the way to cope with that is to think about doing something to get your mind out of that negative thinking spiral. And that getting into that task mode network is what relieves the symptoms. So our new brain, which is the frontal lobe, hosts flexibility, insight, and empathy. Our back of the brain, the amygdala, our old brain, hosts fight or flight response. So this is where stress contributes to the release of cortisol and the stress hormone, and this can cause an inflammatory process which can impact your health. So I'm sure many of you have heard about this, and also people have been talking about this year, that they've been sort of functioning in fight or flight because we've all gone through trauma and completely reshaping our lives. And the goal is for us to not function in the amygdala, but to move it into the frontal cortex and to move away from the amygdala and strengthen those connections in the frontal lobe and the prefrontal cortex. So next part that I'm going to talk about is how to deal with this. So I wanted to give you some information as to why this happens so you can understand the purpose of why it's important to manage your thought process and why it's important to do task-oriented behaviors to manage stress and isolation. So the first part is I'm going to get into the negative thought process, and I'm going to give you a 3-step tip as to how to deal with the negative thought spiral. And then the second part is offering some coping skills and some strategies. 3 steps to cope with negative thinking during COVID-19. So step 1, acknowledge and validate how hard this is. Many people are struggling with loss, change, and various stressors this year. Denying such feelings causes further self-shame. It's okay to not be okay. There is a purpose for feeling when you are feeling sad and feeling angry. Those are all appropriate emotions. And when we push them down and we try not to feel something, that's actually active work, and it stimulates the amygdala, and it stimulates the fight or flight response. So allowing ourselves to acknowledge what we're feeling and to experience it in the moment. And that doesn't mean you're going to sit with it all day. So it doesn't mean that if something's upsetting and you cry, you spend the rest of the day crying. It means to give yourself a moment and say, okay, this is really hard. I'm having a hard time, and that's okay. This is warranted. It's okay that I'm crying right now because this is difficult. And pandemic living's been hard on all of us, and admitting that you're overwhelmed, sad, or disappointment shows strength. Sometimes just admitting to ourselves and others that we're struggling can provide relief. So fighting the spiral of negative thoughts. So I'm sure all of you have felt that at some point this year during the COVID experience, where you get triggered by something that's upsetting. And it's really easy to get caught in the rabbit hole of negative thoughts. So sometimes you need a reminder that your thoughts are just your thoughts, that you don't have to accept everything that's going through your mind at the time as your truth. Once you're triggered by a negative experience or stressor, it's not uncommon to set off the negative thoughts. That's because of the way our brains input stress. Emotional stress, anxiety, and depression can trigger the cortisol response in the brain that I just talked about with neuroplasticity. And then that sends the messages to the amygdala, which stimulates our fight or flight response. It's the same reason we have similar stress responses. Some people cry when they're upset. Some people get irritable. Some people are avoidant. Some people will, avoid that trigger. But usually we have a similar response. And I'll hear people say, well, I'm a crier. And probably because when you've had difficult things happen, crying was relieving to you. Or there are some people are, when they get upset, they just shut down. And your body learned to deal with things in that way. So once we get triggered by something, it's very common for us to allow negative thoughts and narratives to take over. This is natural, but you need to actively fight those thoughts. So one way to do that is to write down a list of ways to combat that negative thinking and put it somewhere that you can access, like a phone or a computer. So when you get into that negative thought spiral, you can remind yourself of why those thoughts might be irrational and not be true. And cognitive behavioral research, I'm a cognitive behavioral therapist, has shown that over time, this pattern will improve. So if we don't allow ourselves to go into the catastrophic thinking and we center ourselves and go over those thoughts and say, wait, maybe that's not true, it can improve over time. So I'll give you an example. So it's very easy right now with the pandemic. So we could go 2 ways. So if you listen to news this week, you could go one way and be like, oh, that's great that, the vaccines are getting rolled out and more people are getting vaccinated, and they've just, they've increased production and we're heading down the right road and the weather's going to get better. Or you can go into the negative thought process and focus on, oh my gosh, there's variants. We're never going to get out of this. We're never going to reach herd immunity. So it's very easy to get caught in that negative thought spiral. And you could go either way. But if you remind yourself of the positive, you remind yourself of those good things, then you don't get caught in that negative spiral. And it takes active work to do that. Find a positive distraction through actionable steps. So when I explained this a little bit more that when we talked about being task oriented and that part of our brain, but when we get triggered and we're upset, we often will think, why? If I can just figure out why I'm feeling this way, that we'll stop feeling anxious or depressed and the stress will dissipate. But it's actually not the case. When we experience stress, our thoughts can go back and forth and they can be ambivalent. So we might contemplate, I could do this or I could do that. And we don't get to the why. And this is what I'm talking about just when you're in a bad mood, not when you're triggered by something that's upsetting, that's very concrete, such as you're upset in the context of a relationship, you're upset with a coworker, you're upset with a significant other, and there's something that you need to problem solve and find a solution. But when you're feeling badly and your mood is off and you're just not entirely sure, what you actually need to ask yourself instead of why am I feeling this way, if you don't know why, and the stressor isn't apparent, is to say, what do I need to do right now? Okay, I'm feeling upset and I can recognize that. What do I need to do to get my brain to get out of the stress response? And it's the doing of something different that activates your brain to focus on something else, which will in turn decrease the negative thinking. Coping through actionable steps. So choosing the right coping skills. So we're going to talk a little bit about some potential coping skills that you can utilize. Coping skills are not a one size fits all. You want to find the right ones that work for you. So think about it just like you're going to go to the store and put on some clothes. Not everybody likes the same pair of jeans. And we all come from different experiences and different things work for different people. So don't shame yourself if something doesn't work. I've had people say to me, well, I've written in my gratitude journal and I've tried meditation and it's not working for me. Okay, well, let's try some of the other things, like exercise seems to work really well for you, or writing in a journal in the moment when you're upset works well. So choose which of the coping skills work for you. And the other key to this is to find balance. So to make sure that when you're choosing coping skills, that you choose from an array of different things and make sure that, you know, some of them are through movement, or some of them might be being creative, or not doing all the same thing at the same time. I know a lot of people have experienced Zoom fatigue this year, and you get off a Zoom call from work and, you know, you're fried and you're, whoa, hold on. I've been sitting on this Zoom call all day, and we feel exhausted. And that's because your mind is focused on one thing, which was really different when you potentially were in school or in work, when you were doing that same thing. And maybe you were grabbing a cup of coffee, or you were looking at your coworker and you had different stimulus around you. And so if you've had a full day of Zoom, reading after a full day of Zoom might be really hard to concentrate. So it might be better to use a physical activity. So use something that works in the moment. So coping strategies through actionable steps. Connecting to friends and family members. This is really vital for all of us. I know that there are many people on this call today that are not able to see our friends and haven't been able to see family members, or haven't been able to see people as much as they'd like to. And so scheduling regular social calls with friends and family members is really important. And I'm going to hold you to this. I'm going to ask all of you on this call today to call a loved one. It's Call a Loved One challenge. Reach out to someone, one of your friends, one of your family members this week who you might not have talked to in a while, just to try to connect, because that connection with other people is really important to maintain, especially when you're not seeing them in the context of former circumstances. Maintain daily routines. This is so important. And many of you probably realized this year how important some of those things are. You know, those of you who went to work or went to school maybe realize that downtime in the morning, just to kind of transition from like getting ready in the morning and having some time before you start school or work, or the downtime in the evening, allowed you to transition and refocus. So when you came home, you were ready to take on dinner or the next steps, or to talk to your family members. And when we took all of that out and changed our routines, sometimes it made things harder to do. So make sure that you're still setting up a daily routine and sticking to it. It's probably one of the most important things you can do. Make sure that you replicate daily routines, which are similar to your pre-COVID lives. So go for a walk, do a chore, read, but allow yourself 15 to 30 minutes to transition. Those transitions are important. You know, you can't just go from Zoom. You might need to go out and go for a walk for a little bit. And even if it's for 5-10 minutes, or get up and vacuum and do a chore, just do something to get your mind to focus in on something else. Get moving. So get your heart rate up and change your scenery to break up the day. So I recognize that there's some people on the call who may have physical limitations who aren't able to do this. And so that might be moving your arms around or doing physical therapy with Zoom or whatever it is, just to get a little bit of movement. And so you might not be able to go run a marathon, but you could get up and you could move rooms. You could walk around and do some chores. You can vacuum. If you can walk, please get outside and try to walk as much as you can. I know that that's been really hard over the last 2 months, and I think that's probably what's contributed to some of the pandemic fatigue for those of us who live in the Midwest and much of the Northeast, which is 70% of the US. We've been snowed in for a while, and it makes it harder. So if you can't go outside, you know, try to do something inside. Could be stretching, but if you can go outside, walking is probably one of the best things you can do. And the studies are showing that this has been beneficial for brain health. Journal or write. Journaling and writing can be really good to vent your feelings. Sometimes it helps you to organize your thoughts and to distinguish between irrational versus rational thinking. Just that process that I was going through before, and that 3-step process of working through your thoughts. Sometimes sitting down and writing and asking yourself, is this rational? Like, is this thought really rational? Is this really happening that nobody cares about how I'm feeling right now? What would I tell a friend? So who is in the same position? So try to write it out and think about how you're feeling. And maybe sometimes it's good to write it out and then come back to it and say, okay, am I still feeling this way? Maybe this is valid and I should address it. Using a gratitude journal to remind yourself of your strengths and all the good things that you learned this year. Even throughout all of this change, there's probably some really positive things that came out of living during the pandemic that you recognize actually did work for you, and things in our former lives that may not have been working, and to remind yourself of the things that you do have. Utilizing mindfulness and meditation skills. So reading mindfulness workbooks or using a program or a meditation app has been very effective for a lot of people, and particularly people who suffer from clinical anxiety and depression. And we've seen this through research that mindfulness and meditation skills can help improve the gray brain area in the frontal cortex. So use a joyful distraction. So if you've had a long day, listen to a music, listen to a podcast, watch a fun TV show, or stream a concert, or theater, or craft, or cook. Do something that you naturally enjoy. Try something new. You know, try something that you hadn't done before and hold yourself to that. Don't force yourself to do something you don't like. So if prior to the pandemic, you were really into cooking, great, continue to do that. Use that opportunity to spend more time looking through, cookbooks and cooking a fun meal. But if it's not something that you're really into, and there was something else that you were doing, or you really loved listening to, live music, listen to live music, stream something, do something that you want. Don't force yourself to do something that's not fun. I've got more. Thought we were done with all our coping strategies. Join an online community. Well, here you are. One of the best things that you can do is to try to find a way to continue to do something with friends and family members. So just staring at somebody and having a Zoom conversation when there's not a lot going on might feel like you're going to, might feel like work or school or an interview. We have to continue to have ongoing activities that we do, and having shared experience with somebody is how we build bonds. So we have the opportunity to do a lot of things online. So join an online religious group, join an education group or a book club. Do something that might be something you did in person before, but allows you to still stay connected and do something that you enjoy. And you came here tonight. IDF has been amazing this year, and they're doing a ton of programming, and they talked about the painting program earlier on today, and it's a perfect example of having an online community with other people within the PI community that you can connect with who are going through the same things, but doing something fun. Change your scenery. Our brain is not used to limited sensory options. So for those of you in apartments, or you're in a space and you're sharing it with other people, with your kids and with your spouse, and they're trying to work, try to move to a different space in your home. Go for a ride, go for a walk, try to get out and not just be in the same space. So the same space that you work is the same space that, is your living area. It's our brains don't function that way. We do better when there's other things that we're looking at and seeing. And so change that scenery up a little bit. Monitor social media. Social media can be very useful in terms of keeping us connected. As with anything else in our lives, if it begins to feel uncomfortable or toxic, step away and take a breather. I think this is important. Social media, prior to the pandemic, we know this in the chronic illness community. It's not that social media isn't good. It's just how you use it. Social media actually can be a lifeline for many of us. There's individuals on this call who I know are very active within some of the support groups online through Facebook. And that's been one of the major communities that people have been involved in throughout the pandemic. So that's the point of social media, was to help connect people who couldn't always be together in a physical way. And that's what we're doing tonight. So continue to use it. It has value, but if you're feeling that it's becoming uncomfortable, step away. Planning ahead. So make short-term plans and longer-term plans with flexibility, knowing that both can be canceled at any time. Using your chronic illness set, this may seem vaguely familiar. All of us were used to this prior to the pandemic. There's many times where we got sick or we were having a flare, and it's usually at the most inconvenient times. And so we've learned how to kind of navigate that and figure that out and have conversations with friends and family members. And I think we're going to have to continue to do that, and continuing to have those discussions to help our friends and family members understand what we're comfortable with, how we feel safe as things continue to move ahead during the pandemic. Coping strategies based on your circumstance. So when you're thinking about utilizing some of these coping strategies that I talked about before, you also need to think about your own personal experience. So for parents who are working and trying to homeschool their kids and without any respite and without care, setting some alone time or time outside of your family to utilize however you choose. And that just may be that, your significant other or a family member takes your kids and you need 30 minutes, or you may be divorced or, living alone with your kids, and you say, hey guys, you know what? Mom needs, or dad needs 15 minutes. I'm just going to go in my room for 15 minutes and take some time to myself. It's to reestablish those boundaries is really important, because when we get burned out, we don't help anybody. And learning how to say, hey, it's important that I do get some time alone. This has been really overwhelming. For those of you who are living alone, one of the studies that I talked about earlier today talked about the impact of isolation and how hard that has been on the pandemic to really physically be alone. You may have been living alone prior to the pandemic, but that's very different than living alone now. Living alone prior to the pandemic, you may have had many more social engagements during the day, at work, or even through doctor's appointments that you may not be attending. You might be getting your infusions at home now instead of at the infusion center. So if you do live alone, set up a weekly call or a Zoom in a safe way. And if you can, and you can meet in person, and that feels safe, depending on your circumstances and comfort, do that too. But you need to have ongoing contact and set that up and make sure it's scheduled. You may realize, oh my gosh, I've gone a couple weeks and I'm really not maintaining my contact with people, and it's really starting to wear on me. So for college or graduate students, I know this has been really hard for you too. You're in this very developmentally important, pivotal time in your life, and whether you're a freshman or you're a junior, or you're in law school, or you're in high school thinking about going to college, it's not the same experience that you had intended, and you can feel that same isolation too. So If you are able to attend school in person and you are staying in your dorm and you're not able to see your peers as much, break up the semester. Find a safe way to go home for a little bit and break it up and get some human contact, and then you can go back if you need to. And if you're home and you can't be with your classmates on campus, continue to maintain those consistent relationships. Community, community, community. I can't say this enough, and you're on here, which is part of your community. It's part of being a part of the Immune Deficiency Foundation and a part of our greater PI community. Collective grief leads to resilience and a sense of community and connection. Grieving alone leads to isolation. You are not alone. We are here. You logged in on this call today. We know that when we grieve with one another, when we share that experience and say we're all in this together, you feel like you're going through something together, and that we go through this difficult time and you come out on the other end feeling more capable and feeling that you've gained some skills and you got through something difficult. And when you grieve alone, it leads to you feeling isolated. So know that you are not alone. And please, I encourage you to continue to reach out and participate in the IDF online functions, because it connects you to our greater community. Mental health resources, finding help where you need it. So I'm going to provide a set of different types of resources that you can use for your mental health toolkit. And so in the same way that we think about physical health, like, oh, we should exercise and eat healthy and think about balanced sleep, we should also think about our mental health and use resources on an ongoing basis. So for mindfulness and meditation resources, I provided 3 different apps that you can use, and you can choose which one you like for yourself. I don't have a preference to any one or the other, but it's just so that you have this available to you. Smiling Mind is great for young people. So it's free resources, age 7 to 18. It's age targeted, I believe, and I may be wrong, it's somewhere between 2 to 5 years. So, I think they have apps between, for like 7 to 9 and 9 to 11 and 16 to 18. And they're created by educators and psychologists. Insight Timer is a guided meditation, so it allows you to set up meditation times, so you can choose based on how long you want to do it for. And Headspace has been very, very popular. A lot of people have heard about it, and it's often on TV. It's free, and it provides consistent daily 10-minute meditations that you can use. I also included mindfulness and meditation resources books. So if you're a reader and you prefer to read, I have a series of books that I recommended. MBSR, so mindfulness-based stress reduction, which we know helps patients with PI to improve outcomes and decrease anxiety and depression. Their daily practices from the Heart of Mindfulness-based stress reduction. It's really good for kind of daily, the daily skill set. And I introduced you to a little bit of some CBT skill sets tonight in talking about the 3 steps to dealing with negative thought process. But these, in this book, it talks about daily mindfulness techniques that you can use. The second one, Full Catastrophic Living, How to Cope with Stress, Pain, and Illness Using Mindfulness Meditation. This is John Kabat-Zinn. He's the founder of Mindfulness. And he started this program based on patients that he was seeing who were dealing with chronic healthcare conditions and how to help them deal with stress and pain. And this was his original book. And I still find it to be quite useful. Patients still continue to really like to use it. And I always recommend it because it's a nice introduction to learning a little bit about mindfulness meditation. And then the last is a mindfulness-based stress reduction. It's another MBSR program for enhancing health and vitality. Mood trackers and journals. Ways to track patterns in mood, behavior, and feelings. Mood trackers and journals have been more recent, and I really encourage you to use them. I have found my patients have really enjoyed using them. It's allowed them to increase their insight, to figure out patterns, and in your ability to increase your insight and figure out patterns also helps you to get more control of your emotions. So if you're tracking your mood and you recognize, wait a second, I realize I've been in a bad mood for the last 2 weeks. What are the things that are contributing to my difficult mood? And maybe I don't address some things with a friend, and maybe I'm not really mad at my friend. I'm just upset because I've had a difficult time. So I had listed a couple of those options, and you can choose whichever one works for you. And then lastly, mental health resources. So these are just a list of different associations and institutes and groups that you can use, and foundations to help in relation to mental health. There's more mental health resources because we can't get enough. So I have listed on here some journals and magazines and pretty much every topic related to mental health that you can use. And those are my references. And that completes the talk part of my program. And this is my contact information if for some reason you'd like to get in touch with me.
Thank you, Jodi. Absolutely wonderful presentation. Thank you, thank you, thank you. Okay, we are going to start asking those great questions that many of you sent in. Let me just get those questions up here. All right, first question. Jodi, do you have an easy way to explain PI to family and friends? You know, we look good, but we have this diagnosis and people very often don't understand.
I sure do. So if it's somebody you know, so if it's family or friends, what I typically say is that I'm missing a part of my immune system that doesn't function appropriately. So it's genetic. I was born with it. I can't fix it, but that I'm unable to fight off infections in the same way that everybody else does because I'm missing part of my immune system. And the reason that I say that I'm missing part of my immune system, and I'm going to get to this in a second, why we now can say something very differently. And I thought about this on Monday. Now that we're talking about plasma and antibodies and during COVID, oh my. But I think people often confuse immunodeficiencies with autoimmune conditions. And although many of us have autoimmune conditions and many autoimmune conditions, that's separate and that's understood as that our body's attacking ourselves. And what people often don't understand is that it's the germs attacking us. So that's what I typically say. I now say something different, which is really fabulous. This is one good thing that came out of COVID, is that we now have language that no one else understood or could talk about now to explain about the immune system. So what I say now is that I say I'm immunocompromised and people understand what that means. And I said, just like, and I'll say, just like you don't have antibodies to fight off COVID, we don't have antibodies until we got the vaccine. That's how my body responds to everything. So because me personally, I happen to be on IVIG, I take it a step further for those of you on IVIG. And I say, you know, the plasma, how they're talking about convalescent plasma. Well, every 2 weeks, I get that to replace the antibodies so that I can fight off all the other known diseases. And it's working. And I've seen more light bulbs go on this year than I've ever seen in my life. So I do think that's one good thing that came out of the pandemic. And I would try to use, we now have some language that people can understand.
Thank you. How can I tell a family member when I'm feeling fatigued and I need to rest?
So there's a really great language use of this. There's a woman who had lupus who came up with a theory called the spoon theory, for those of you who don't know what that is. And she came up with this theory to describe what happens for those of us who have chronic healthcare conditions, that we only have a set amount of spoons. And so able-bodied people have an infinite amount of spoons, and they can go to school and work and then vacuum and eat and take care of their kids and do whatever, and they feel great. For us, we have a limited amount of spoons. And so we can only use, let's say we have 6 spoons and we used 1 spoon that day for work and 2 spoons that day because you weren't feeling well, and a third because you're walking your dog, and then you're done for the day. And the spoon theory, I think, is a really great way to give people language to understand that our tiredness and our ability is based on limits, and it's not based on what we're doing. So just because you might have had the energy in the morning to do an exercise program and go to work doesn't mean you're not going to be exhausted at night. It just means you have to choose from the spoons and you have a limited amount. So I encourage you to look up the spoon theory. If you Google it, you're going to see tons of things on that. There's lots of people in our chronic illness invisible world who refer to themselves as spoonies, and it will give you language to talk to people about it.
I'm not sure if this is more of a medical question, Jodi, but this one is, do you hear from people with primary immunodeficiency that suffer from insomnia?
Oh, yes.
Yeah.
And if you have the opportunity to decide to sign up for any of the Facebook groups, there's IDF sponsors some of the connected Facebook groups. I believe there's one that has an insomnia club. There are many of us, who have primary immunodeficiency also have multiple chronic healthcare conditions underneath that umbrella. Oftentimes, our body's working on overdrive. A lot of times, many of us, because we get chronic persistent infections, we have problems with asthma, we might, or inflammation, we might be on steroids, and steroids can keep you up. So many of us have problems with insomnia, but I want to take that away to something that Kathy had mentioned in the beginning and said, maybe that's a medical question. The other part to differentiate between medical and is this a clinical mental health manifestation of insomnia is if you're waking up in the middle of the night or you can't fall asleep because you're on steroids or you're physically uncomfortable or you happen to have slept throughout the day and your sleeping's off, that's one thing. If you are having difficulty going to bed, or you're waking up in the middle of the night, or you're waking up early in the morning and you can't stop thinking about things. So you are ruminating about things that are going on in your life, and that's what's disrupting your sleep, then that's related to clinical anxiety. And there is a differentiation between those two things.
Thank you. I'm very troubled knowing that the vaccines my friends are taking may not work or will only be partially effective with me. Until there's a herd, so to speak, I really don't see how I'm going to feel differently. Any thoughts about that, Jodi, on, when those thoughts come in, what do we say to ourselves?
Yeah. So I'm not surprised this conversation's coming up. I'm dealing with this myself. I had to have this conversation with a friend today who said, oh, well, you got vaccinated, so I can come visit you. No, not yet. So I think there's a couple things in all of this. And that's part of why I mentioned that tonight in my negative thinking spiral. So I want you to hold on to hope. Everything continues to change rapidly. So even this week, within 1 week, the 2 companies that were producing, both Moderna and Pfizer, are rapidly increasing their production to get the vaccines out to everybody, which increases the time in which those things are going to be addressed. So I think what you have to do is just hold on to hope. I think that we are at a very, very different point in the pandemic where before we didn't know, did we know the vaccines are going to work? Are they not going to work? How long is this going to take? So I think what you have to say to yourself when you get into the negative spiral, because I recognize that it may take a while to get to herd, and I recognize that some of us are not going to respond to the vaccine. And we're herd dependent, and we might be dependent on having some of the, the COVID antibodies showing up in the plasma, is that we will get there. We will eventually get there. And to remind yourself of that. And you went this far. This was the worst part of it. So you got through the entire year. And so just continue to remind yourself wow, okay, the vaccines are in place, they're getting them out, it's going to continue to improve, and the weather is going to get nicer in 70% of the country, which offers the opportunity for the virus to not implode in the way that it had in the fall and winter this year. So it's going to give us more opportunities. And that's the part that I would focus in on. Because for all we know, we could have the way they're going now and everything keeps getting better. For all we know, everybody's vaccinated by July. We don't know. And it's very easy to be like, oh my God, we're never going to get a vaccine. And then we could have spent the whole year going, oh my God, a vaccine's never going to come out. And guess what? We have one. So focus on the positive.
You talked a bit about the spoon theory, and you talked about how to explain PI to family and friends. Do you have any other information or advice to share for us in regards to family members who don't take our illness seriously?
Well, this is a fabulous year to explain how serious it is. First and foremost, we were listed under the CDC as one of the conditions that was at high risk. So there and then you have something in writing that shows that the medical community is describing that we are a part of several different disease states that were considered high priority. So I think that maybe talking to them a bit about explaining this year that, I am high risk. And not only am I high risk, it's not because I think I'm high risk, but that the medical community recognizes that I'm at high risk. And explaining to them that, think about how you felt this year with COVID and how scary that was and how vulnerable you felt. That is what I have for all of the other diseases. That's what I feel, that for me, my immune system does not function in that way. And it's very serious. So I may look good to you. And that's because I work really hard and because I have a lot of strength and I have my medical community organized. But the severity has been listed this year, even by our government.
A comment. One of the most difficult things I'm dealing with is watching my sons who work in healthcare have so many patients die on their watch, and it takes a toll on them as well. They're exhausted and it's affecting their families. I so want to share some of this with them.
So just that you want to share some of the coping skills with them, please do.
Yeah.
So I think, part of why I wrote everything out today was actually with that idea in mind. Everybody's having a really hard time. And so my presentation can be, used in other contexts to help people learn how to cope with all of these things this year. So please feel free to share that.
Next question. Well, first of all, everybody might not know what EFT or emotional freedom technique is, Jodi. Do you have any information about that you can just briefly share with us to say this is what it is? But the question is, does emotional freedom technique or EFT tapping without a personal counselor help immunity or mental health? Is there any research to show that it is helpful?
To be honest, I can't answer that question. I'm actually not sure for that specific question.
Thank you. I live in an area with many people who are anti-mask, anti-vax, and don't even believe COVID-19 is real. It is making me wonder if I will ever be able to come out of isolation. And it makes me angry that as a matter of fact, I don't think I've ever been as angry as I have this year. Do you have any readings or resources to help me deal with this anger?
Yes. Yes, the resources I provided tonight will help you to work through that. And I'm going to start off with the first thing I talked about, which was to validate that. And you have every right to feel that way. I felt that way too. One of the things I think that's been so hard about having PI. And I know that, you know, this is why I'm on this call. I'm living with this too. And the whole, you know, when we were all in this together, and I live in New York, and when this began, and everybody was really supportive, and until people got pandemic fatigue and misinformation, and, you know, and then the pandemic became politicized, and it was really awful, because that's our safety risk to us. And so you have every right to feel the way that you're feeling, because all the things that you mentioned, it provides respect. It provides respect and safety for us. So my recommendation in dealing with some of the anger is to start utilizing some of the tools that I listed tonight, to start having a place to talk about some of this stuff. And one thing I didn't talk about today, but I will bring up tonight, is I also encourage you, you know, if you have access and you feel like it would be helpful to talk to somebody, to talk to a therapist. This is the first time that we've actually allowed, insurance companies are covering the cost of telehealth, and it's more accessible. They've allowed through, now they're tightening up a little bit, but with state lines. So but therapists currently can even move across state lines right now and get an emergency license if need be. So there's more accessible care that's available. So if you feel like you need a space that's outside your friends and family, and you really need a space to process this, I encourage you to actively seek mental health treatment. And I can't think of a better time to do it than now.
And that is the end of our forum tonight. Jodi, amazing, amazing. Thank you so much for being here. And
I can't wait till we can do it again in person. I miss you.
oh, I agree. And opening your heart and your mind to us. And, you know, we're all in this together. I have a son who has CVID, and, you know, on we go with hope in our heart that this pandemic will be over and we will be on the upside very soon. So everybody, thank you. Thank you for being here tonight. Thank you to our sponsors for making this possible. And we look forward to seeing you next week on Thursday. So take care and be safe and have a good evening.